What's up, YouTube? And this time I'm going to talk about healthcare. And you all probably see the thumbnail is the Luigi guy. He got accused of taking out the United Healthcare CEO. And some people thought it was a hit, an inside job, maybe. You know, the guy's 26. I've even heard some people on YouTube say they don't think that Luigi is the guy. They think the real person is still out there and this is the fall guy. Who knows? And I saw a lot of people, some videos of people actually praising Luigi for taking out the CEO. A lot of people who were just really mad about healthcare, uh, the costs being denied, claims that's a matter of life or death. I heard one lady put on TikTok saying a CEO shouldn't have to pass away, but people shouldn't be denied health care either. So that was crazy how many people was coming out actually on Luigi's side. 26-year-old guy. They say he's from a wealthy family. And so I don't know what his motive is or was, if he's the actual culprit. But all of this surrounding healthcare and it's really shedding a light on things. You see Donald Trump appointed Robert F. Kennedy Jr. to investigate the FDA, the Food and Drug Administration, dealing with the coloring they use in foods, just things that affect our overall health. That a lot of these foods people feel contribute to health issues, to where you need health care, you're on medication that you're paying for every month. There's no cure, and the money's in the comeback, not in the cure. And so the FDA, big pharma, they make so much money. It's a billion-dollar industry off of drugs to keep people coming back, so they pay money each month. And so everybody needs healthcare. You need coverage. And I want to start with Medicaid and Medicare for senior citizens. Does that cover enough? If you're a senior citizen and you're listening to this, does your Medicaid or Medicare, whichever one you're on, do you feel that covers enough for you, for your checkups, getting your blood taken, things like that? Do you ever have to pay out of pocket? If so, how much? Or if you have family members who are senior citizens, have you seen Medicaid or Medicare not cover enough of the hospital expenses? And so sons and daughters, whomever, nieces and nephews, are coming out of their pockets to help with the expenses for your older family members. Let me know. For all the Medicaid and Medicare recipients out there, do you feel that's enough coverage, or could they improve upon that? I know it's you work, you retire, you had that for your health care insurance, for your daily physicals, and you a senior citizen. Do you feel you're getting the best quality care? Because I want to circle this all into healthcare for everybody, senior citizens on down to the youngest people. Because it's crazy out here with people just not being able to get the help they feel they need from the doctor, trying to get the medication from the pharmacy, and the cost of it. It's a mess. And this incident with Luigi and the United Healthcare CEO has really shed a light on the issues that's been ongoing with healthcare in these United States. And so Canada has free healthcare. Do you all think that could work in the United States? I'm not sure how it's structured and how it actually gets paid for, if it's through taxes or whatever the case may be. I've been there 4 times, never, not for any type of health issues, but yeah, their health care is, it's free, and it's been free for a long time now. Could that model work in the United States, do you all think? Free health care, everybody gets covered. There's so many people who are without health coverage in the United States. If you live in Chicago, you can go to the county hospital if you can't afford health care. And so it's, trying to make it affordable for everybody. I know I've seen these advertisements here in the States for healthcare.gov, where you can get on a payment plan to have some type of coverage. I don't know how much that actually covers, because it's real cheap. Whereas Canada, everything's free. And so your surgery, whatever the case may be, that's money that you get to keep in your pocket if you're a Canadian. And so how many people here listening to this would like the idea of free healthcare? I'm sure you all would in the United States. And can that work? That's the other thing. Because I'm not sure how Canada is set up with their healthcare and how that all gets paid for, but it's free for all the Canadians. So it's definitely an interesting model, and would love to have that here in the United States. But this country is now in so much debt, 36 trillion, after they just signed a new fund for the national defense. They signed a bill. They passing it to Joe Biden now, so he can sign it into law to fund the national defense. That's costing $1 trillion. So it's taking the United States debt even higher. And so I don't even know how free healthcare fits into a country that's so far in debt, when you look at the finances of it all. So, but hey, Canada, they're winning there with the free healthcare at least. So that's big ups to them. And this healthcare situation in the United States has to improve some way, somehow. I don't think it can stand the way it is right now. And if RFK Jr. can really get into the Food and Drug Administration, and even just what they're doing with the foods that could be causing people to get sick, where you have to rely on healthcare more than you need to, maybe we can see changes in that with this Trump administration. So, it's just a thought. What else did I want to? Another point, you've had people who have complained about having had loved ones lose their lives because they couldn't get covered for a certain medical procedure or get certain type of medication because of the cost, and being denied claims. And so you have people in the United States who have had to now plan funerals, all because healthcare didn't give them enough coverage. So how do you all feel about that? And I think those things haven't happened to people's family members and friends, is why you see, not that I'm saying this right, so many people cheering on Luigi and thinking he did a good job taking out the United Healthcare CEO, because of, I guess, so many lives, just his one life, so many lives that have been lost because healthcare is, not covering enough, or they drop people. And United Healthcare is one of the biggest healthcare companies out here, and they own smaller healthcare companies, and people have had issues with them and their claims. And so a lot of anger being held in with that company in general. And then, like I said, you have reports of people not being able to get the care that they need through their health care, and them losing their lives. That's the ultimate. And so families are in an uproar, distraught. And so that's just bad all around when you have people, just as something as simple as getting a procedure done or certain medication, that leads to you losing your life just because your healthcare company doesn't want to cover you for whatever reason. And it seems to always all come back to the money, as it always does. And it's just unfortunate, and it's a shame that people have lost their lives over not being able to get the healthcare coverage that they need. And these are people who actually have policies, but for some reason, no matter what you're paying into your healthcare company each month, I guess they choose what to cover and what not to cover. They treat people like, I guess, auto insurance, whatever the case may be. If you looked at as a risk, your premiums are higher, they'll drop you. all type of things. So you got people that's really worried about their coverage. They don't feel they're completely insured, and they have a case. They have a bone to pick, you know. And so, like I said, something has to be done about this healthcare situation in this country. It can't continue to go on. You know, and I'm sure you all agree. My next point, have you all ever been denied a health insurance claim? Have you ever filed one and they said no for whatever reason? If so, what was the reason? Put that down in the comments. What are their reasons for actually denying you your claim? Why didn't it go through? You know, do you feel the reason was sufficient? Probably not. Would you ever consider suing your healthcare provider for claim denial? You know, taking them to court. You know, what was the reason for them actually denying your claim? Thank God I've never had to file a claim with a healthcare company, but I know a lot of people out here I'm sure have, and I just want to know, you know, what was the reason that they gave you all for the claim denial, why they didn't want to move forward with something you really needed. You know, was their explanation satisfactory? You know, what's the reason behind them saying no, we can't process this after you've been paying, you know, every month into that particular company just so you can, you know, be covered, have your children covered, whatever the case may be, whoever you have, you know, if it's multiple people on the policy. And you know, if you all want to say it in the comments, hey, who are you with? You with Humana? You with Blue Cross Blue Shield, Cigna? You know, there's so many of them. Is there one in particular that you would actually recommend that does a good job of coverage for medical, dental, and vision, whatever you need? I don't know. Or do you all think they all just all in on it under the FDA and, you know, they're all the same? No one healthcare company is better than the other, and they're all just out for money. If that's how you feel, that's fine too. You know, put that down in the comments. I want everybody to be honest about this discussion about healthcare. And are you happy with your coverage that you have right now, if you have it? And if you don't have healthcare right now, talk about it in the comments. You know, what's the reasons why? Is it, again, too expensive, like I've said? Did you have it, but then you got laid off from your job? Or if you're working for yourself, but even the money you bring in from your business, the cost of healthcare, you just not able to, you know, afford that right now? You know, what's the reasons that you're not insured if you're not? You know, put that down in the comments. And, you know, don't be afraid. And, you know, it's an open discussion about healthcare. And so, again, going back to the healthcare and the coverage, why do you all think it's so expensive to have healthcare in the United States? Top-notch healthcare. Why is it the charge so high, the premiums? And do you all think it's worth it? What do you all think most of that money is going to? Because we don't see any cures for anything in terms of where, okay, now you don't have to come out your pocket every month for medication. This illness is now gone. And so, and do you all think they just, again, in it for the money? No type of cures. I mean, you hear stories over the years here and there about maybe getting close to a cure, medical research. Then after that, you don't hear anything anymore. Sometimes some of those doctors go missing who may have went online and said, hey, you know, we really feel we can make a breakthrough with this. But again, you know, the actual curing and not needing medication takes away from money every month that people paying to fill their prescriptions. So it's one big never-ending cycle of people getting sick, maybe not necessarily staying sick, but needing the medication to function for whatever injuries they've had or whatever type of imbalances they have in their body. And I'm not saying it's easy to find cures, but it doesn't seem like medicine is progressing anywhere to where people don't need medication every month. And you really don't want to get caught up on that, get caught up on pills every month, having to take those. That's not how you want to live. But you have plenty of people in this country, in these United States, that are doing that. And the pharmaceutical companies are making so much money off of that. And so I've heard this so many times about they're not here to improve health, they're just here for profit. The Food and Drug Administration. And it just seems more and more true. They're just out for the cash. Not to make sure you and I are healthy. You see that with what's being put in the food at the grocery stores, at the restaurants. And so now you keep eating all of that, and you end up needing to get on medication for stuff and ingredients that they've put in foods. My mother even told me about an ingredient she read on the back of some foods where it said biodegradable, something that they're putting in food for that. I think it's supposed to help preserve the food, maybe. I don't know if you all have seen that on the back of any food items in the grocery store, but it says biodegradable. And when she told me that, I said it sounded like something being made in a laboratory. But yeah, it's just some type of altering that they do to the food. And she actually found out about it from a lady who did a video on either YouTube or TikTok, and the lady was saying, don't buy anything, eat anything where you see biodegradable on the back and the ingredients. So that's just a heads up for anyone listening to this. If you see biodegradable on whatever you pick up at the grocery store, your Walmart, your Jewel, your Kroger, Myers, wherever, Amazon Fresh, check the back of that and look for biodegradable. And you might want to put that back on the shelf if you see that in the ingredients. But again, all of these things lead to me and you getting sick and needing the health care way too much. And then, they charging you every month, whatever they cover and whatever you have to pay out of pocket. And then you need it. And so now you got people not being able to save as much money as they want to because you spending all this money on your medicine each month, and God forbid if you have to have a surgery done, which that price becomes astronomical. So it's we almost on our own, and we just have to watch ourselves, still have health coverage, but do what you need to do to where you don't have to necessarily rely on it all the time. Hey, if something happened, you just got small pain and you just taking a prescription for one time, that's fine. But we really don't want to be in situations where we have to fill this prescription every month and now we on drugs each month. So it's all just food for thought and something to think about. People so upset with the healthcare system in the United States. I'm not saying it's right that people are cheering on the fact that Luigi took out the CEO. That's not worth someone's, life. Even though people feel their loved ones have lost their life due to lack of coverage and blaming the healthcare companies. So, I get it. So it's just so much, so backwards in this country. It's been backwards for a long time, healthcare industry included. And so, if it's all going back to money, then the healthcare industry is probably in bed with so many other corporations, and keeping us sick keeps them rich. And people who work in the healthcare industry right now or are in those offices or used to be I'm sure they can, you know, attest to what I'm saying and actually, you know, give some type of legitimacy to what I'm saying. I mean, they probably wouldn't, not the ones that's currently still there, but the whistleblowers, those that know what the get down is, they can probably back up what I'm saying in terms of healthcare companies and big corporations being in bed with each other just to make money, and you know they don't care about, you know, the American citizens, you know, the ones that they don't know. Now their friends and their family, that's different, but everyone else is just, you know, a number, I guess. So, you know, yeah, it's sad overall, but it definitely has to change. You know, we can't continue to go on like this with healthcare being out of control, and you know, it's definitely political as well in terms of how they're allowed to operate. And like I said, we'll see what Robert F. Kennedy Jr. does, starting with the Food and Drug Administration. And so, you know, like I said, I've heard others say it before, you know, the FDA is just about money, they're not about health. So they approve whatever, and if it takes you down, it takes you down. They've made their money, their moolah, and it's on to the next U.S. citizen. I don't want to go into it being population control. I've heard that too. Get the number of citizens down in the United States by any means necessary, through food, through the drugs, whatever the case may be. These drugs have side effects. So yes, I've heard people even joke saying the treatment make them feel worse than the actual disease they have. So it's definitely something we want to try to avoid. We don't want to get stuck in hospitals and having to be on long-term treatment just because of what they put in food, and now you've been eating it all these years, and now your body is starting to break down on you because of stuff that's been put in the food on purpose. And they know the effects, the long-term effects of what these things can cause that you're putting in these food that you put on the grocery store shelves. So I don't know, maybe it's a lost cause. It could be with things currently the way they are, but you as individuals, we just have to get, you know, smarter and just a lot more serious about health, so we don't have to be on any type of medication and rely so heavily on healthcare. You know, use it to go get your teeth checkups and all of that, get them cleaned and physicals, but we don't want to be a situation where we need it because now we on medication every month. And so yeah, it's not the way anyone wants to live, even though so many do. But for those that are not in that situation, keep doing what you're doing so you don't end up having to depend on taking drugs each month and then just feeding the pockets of big pharma and the Food and Drug Administration. And I really hope some change will come once RFK gets to investigate what the FDA is doing. You know, I don't know. Some people out there might be skeptical, but we'll see once, you know, 2025 gets here. And again, are you happy with your current healthcare if you have it? Do you think it could be better? Do you think it could cost less? You know, are you completely satisfied with the healthcare you currently have? Let me know down in the comments. Like, share, and subscribe as always. Get this video out here to anyone you know who having an issue with healthcare. Let it circulate. And subscribe to the channel, Facts of Feelings. All one word. Like I always say, no spaces. Put Facts of Feelings in the YouTube search, no spaces, and this channel comes right up. And until next time, stay healthy. I'm out.